the Only You podcast. I'm Barbara Schulte, and this is Dr. Lauro Amezcua-Patino. Welcome back.
Thank you, Barbie.
So today we're going to be talking about sleep.
Yes, we're going to talk about normal sleep.
Okay.
Because sleep is so big of an area of medicine that
Yes.
first we need to understand what normal sleep is all about, and then we can talk about, probably in another program, the problems with sleep.
Yes.
I was writing last night about a blog that I have in writing about why is sleep important, right?
Yeah.
Why is it so essential?
Uh-huh.
And what I was writing about had to do with sleep being one of the essential body functions, same as eating, same as drinking fluids. You cannot live without sleep. I mean, is that essential?
Right.
And I'm sure that in your work you see that most patients that come to see us are coming to us with some sleep disturbance, right?
Right. Yeah, it's one of the main issues when you see any disorder. There's some disordered sleep, either too much, not enough sleep, or different times that sleep occurs when it's not supposed to be.
Yeah, if you look at the major psychiatric disorders in the DSM-5, which is our psychiatric Bible, if you may, most of them are going to mention sleep as a symptom.
Yeah.
Whether it's anxiety, whether it's depression. But I think it goes beyond that because we have to talk about, so what is the function of sleep? What does sleep do for us, right? And the sleep is like, it has functions that have to do with the brain itself, and it has functions that have to do with the body.
Okay.
So when we talk about the brain itself, what happens when you're sleeping is maybe two major issues. One is, it's like flushing the toilet, you know.
Okay.
Although the bad proteins are moving in the brain because of what happened during the daytime, are going to be flushed out. So it's actually a cleaning and restoration process that happens in the brain when we go to sleep. The other part is what we call consolidation of memories, meaning that the memories that you get in your short-term areas of the brain during the daytime, stuff that is coming in, the brain actually is going to move them into long-term memories while we sleep. So if you think about it, we spend a third of our lives sleeping, right? That's a lot of time. There are very few things that we're going to do
that long, yeah.
Yeah. So we have to recognize that sleep is important, right?
Yeah.
And a number of other things happen while we sleep that have to do with the body, in particular, regulation of hormones.
Okay.
So a lot of the hormones that have to do with sleep, have to do with appetite, muscle regeneration, all of those different things are going to be happening while we sleep.
Okay.
So if you deprive the brain from sleep, then bad things happen, right? I mean, you work as a nurse, you're a nurse practitioner, you probably remember having to work overnight.
Yes, definitely. And then we can get into some of those shift work problems that can happen. And not just nurses, truck drivers, people that have all these different shift work problems. What kinds of things are we running into?
Well, what happens is that when you deprive somebody from sleep, whether it's just one night, what is going to happen is that restoration in the brain is not happening. The brain is not flushing out bad stuff. So you're going to start by being very fatigued. You're going to be tired.
Okay.
And when you're tired, you're not able to concentrate. When you're tired, you're not able to problem solve. Okay? And your body's going to have a tendency to go to sleep. So what happens first and foremost is that people are going to be impaired. We actually compare not sleeping with having a few drinks. You are as drunk when you don't sleep as when you have a few drinks.
Wow.
So what is the problem with that? The problem is that if you get in your car and you're sleep deprived, you can get into a car accident. And actually, when you look at residents that work in hospitals overnight, when they go home in the morning, the number of car accidents they have is a lot higher than most people. So that is one issue.
Okay.
The second thing that happens with sleep deprivation is that you start storing fat.
Oh, yeah. Weight gain.
Weight gain is a major issue. Why? Because the body's stressed and is thinking that something bad's happening.
Mm-hmm.
So the normal metabolism of fat gets reduced, right? So you have problems with excessive weight, you have problems with fatigue, you can get into car accidents. And then when you're trying to work, it becomes very difficult for you to problem solve, right? So you can see that sleep deprivation is pretty toxic to the brain. In the long term, though, if you don't sleep well for long periods of time, actually your risk of dementia goes higher. Because a lot of these proteins that we're talking about that are supposed to be flushed every night when we sleep are proteins like amyloid and tau proteins.
Right.
And they start getting deposited in the brain, and then you develop the tangles that we normally see in patients with dementia. So you can actually safely say that sleep deprivation is toxic to the brain, right?
Let's talk about those patients who think they're sleeping well, but they're not. We see that a lot with like sleep apnea, those patients that have trouble breathing when they're sleeping. And then over time, we start seeing those patients become very overweight, and they are looking like the patients you're describing. Why is sleep so important for those patients with breathing, all those disorders like hypertension, high cholesterol, all of those things that can happen too?
Well, what happens with sleep apnea in particular, is that the individual stops breathing during the night. So why is the person not breathing? Most commonly is because of obstructive issues, right? So, for example, if you have a very small jaw and a very small space between your tongue and the back of your throat, when you go to sleep, your tongue is going to go back and it's going to block your breathing.
Yeah.
Okay, so what happens when you plug the breathing, you stop breathing, your levels of oxygen start going down, and as the level of oxygen goes down, your brain sends a signal to your lungs and say, wait a minute, what's happening here? I'm not getting oxygen up in the brain. And eventually what is going to happen is that the brain is going to send a signal to the lungs and the diaphragm to breathe deeper, right? When you breathe deeper, you open the space, air comes in very fast, and there's a small little part of your palate that's called the soft palate that starts vibrating. That's when you snore. You snore not when you stop breathing, but when you restart breathing. Okay? So think about that happening 30 times an hour for 8 hours, right?
Yeah.
And so you think about your oxygen going down at least 4 points, or more.
Yeah.
30 times an hour, 8 hours at night. So the amount of oxygen that is missing from your brain, okay,
That's a lot.
it's a lot of oxygen. So eventually what happens is that you start causing problems to your brain because of lack of oxygen. And because of the dynamics of the brain constantly sending signals to your lungs, you start having heart problems. And cardiac failure becomes an issue, and hypertension becomes an issue. Actually, years ago, there was a big study done in Wisconsin called the Wisconsin Cohort Study, that they look at sleep apnea for 30 years, right? They follow these patients for 30 years. And what they found is that the longevity of the patients with sleep apnea that wasn't treated was shortened by about 10 years.
Yeah, I was going to say I'm glad they were still alive after 30 years.
Yes, so you're still alive, but some of them had died, and some of them had some difficulty in terms of chronic damage to the brain from lack of oxygen. So that's why it's so important to get treatment for that and identify it. So sleep apnea is highly overrepresenting on patients that have hypertension, in patients that have obesity, in patients that have diabetes. And the problem is that they don't get evaluated, they don't get seen. So I always advise people, if you have hypertension, obesity, or diabetes, tell your doctor you want a sleep study, right? Because it's likely that the fact that you're not treating your sleep apnea is going to worsen the other disorders too.
Right.
So it's important to stay on top of that. And there are very effective treatments for that. So
Yeah, and I mean, you hear that sometimes too, that those patients, what if those signals aren't being sent and you don't wake up? What if that oxygen...
You're getting into a different type of situation. There's something called central sleep apnea that is not obstructive. It's not happening because the obstruction on your breathing is happening because the signals that are supposed to come from the brain to the lungs are not happening.
Oh, okay.
So that is, I mean, if you've had someone overdose on opiates, that's basically what happens. The signals to breathe stop, right? So the same thing can happen, but central sleep apnea is rare, and we see it in certain conditions, but it's not something that we see a lot.
Okay.
Yeah.
Okay. All right.
Now, back to the normal sleep, I think that there's certain things that people needs to do, what we call sleep hygiene, right?
Yes, let's talk about that.
In terms of making sure that your sleep is going to be healthy. So it starts with having a routine for sleep, meaning you go to bed at a certain time and you get up at a certain time every day, including weekends, right? It is important to not get into bed if you're not sleepy. Okay, actually, we like to say that if you get into bed and 20 minutes later you're not asleep, get out of bed. So don't get into the bed until you're feeling sleepy, okay? Bed is only for two things, sleep and sex.
Okay.
Nothing else. You shouldn't be doing anything else in the bed.
All right.
You should not be using electronics for 30 minutes before you go to sleep.
Okay.
Okay? And we recommend that you don't expose yourself to bright light before sleep.
Okay.
We don't recommend that you exercise a lot before sleep. Don't drink a lot of fluids before sleep. Don't get into bed and watch TV. If you want to watch TV, sit on the sofa, and when you get sleepy tomorrow, turn off the TV and go to bed, right?
Right.
So those are things that you can do, to organize your life. We normally, because of the stress of life and the demands of life, we don't give sleep its importance, right?
Yeah.
I mean, again, we spend a third of our life sleeping.
Yeah.
We pay more attention to other aspects of our life. And when we're not sleeping properly, we're neglecting ourselves. We're really not facilitating, I find people much more eager to exercise than to sleep well.
Yeah.
Right?
Right.
So they will make a whole routine to go to the gym and exercise and all of that. Sleep is more important than exercise.
When you find patients that come to you with depression, anxiety, which comes first? The issues with sleep, that patients that come to you depressed that have sleep problems, or were they having sleep problems and become depressed?
Both. It's very interesting that sleep is kind of an early sign of the compensation when somebody has depression. So let's say you have a patient, you treat them for depression, they're taking antidepressants, they're doing well, and all of a sudden they start losing sleep. Okay, they still don't feel sad, they don't feel terribly tired, they're not feeling terribly unmotivated, but you're starting to see that the sleep is changing. That's a signal that something's coming. So you have to actually aggressively get him to sleep better. Yeah. Because what happens with sleep deprivation that comes from an illness, usually the first sign that is going to feed the rest of the problem, right? So not unusually patients come to you and say, I've been depressed for a couple of months, but my sleep has been bad for about 3 months, right? So sleep becomes important. On the other hand, people that, not everybody who has insomnia has depression, right?
Right.
There are people that have difficulty sleeping. They have circadian issues. They're very sensitive to light. And circadian means the natural 24-hour cycle of the body that is regulated by sunlight and so on. We have a very, very strong relationship with our environment. We actually have a relationship with the sun. And I'm not talking about voodoo here or anything like that. No. I mean, basically, the sun actually stimulates hormonal processing in our body to our eyes, hence melatonin, right?
Yes.
Melatonin is a supplement that we use quite often because melatonin is a hormone that starts going up as the sun goes down, right? And that gives the signals that it's time to go to sleep.
Yes.
Artificial light is a problem. Since the advent of artificial light, we have pushed our bodies to other extremes because we have the ability to work at night.
Right.
probably 2,000 years ago, people will go to sleep when the sun goes down and get up when the sun comes up, right? It's not like that anymore, right? So we have pushed the ability of our body to adapt. And there's some people you just cannot work in the evenings. People that can't work grab your shifts, they really are going to be very fatigued during the daytime, and they won't be able to sleep during the daytime.
Right.
So we have to be able to recognize those, right?
What are your thoughts about sleep aids, sleep medications? And I know for shift work disorder, there's also medications for that too.
There are medications that can affect and reestablish the circadian rhythm, right? So depending on the disorder that we're treating, I think that sometimes we can use sleep medications for short periods of time. Some of the sleep medications may have addiction potential, so we try to not overdo those. But sometimes you have to decide if the patient is able to sleep without medication, right? So there's some rare patients that will require sleep medication for a long time. But we always have to start with lifestyle changes, right?
Right.
I mean, you really have to start with what we talked about before.
Sleep hygiene.
Sleep hygiene and all of that. Cognitive behavioral therapy has become a very good tool to train people into how to sleep if they can do it on their own. And medications, again, depending on what we're dealing with, can help you either stay awake during the daytime or go to sleep at night.
Wonderful. Yeah. What are you seeing? Any thoughts or ideas about how diet affects sleep?
Diet affects sleep. It's not what you eat that affects your sleep. It's when you eat it.
Oh, okay.
So people who tend to overeat at night are going to have more difficulty sleeping because you're forcing the body into a whole process of digestion, right? That is not supposed to be happening while you're sleeping.
What about alcohol?
Well, that's not eating. Okay, that's a separate issue. Alcohol is a great medication to get you to sleep, but it doesn't help you stay asleep, and eventually will affect your circadian rhythms. So we don't recommend that people drink before they go to sleep.
Why do you think so many people do use alcohol to go to sleep?
Because it's very effective to get you to sleep, but it's not very good at facilitating improvement of your what we call deep sleep, right? Because it pulls you out of your REM sleep process. So there are stages of your sleep, okay, that the body needs to go through in order for the sleep to be healthy, right? So when you use medications, certain medications and alcohol can affect the functioning of sleep, the length of REM sleep, the profoundness of your sleep, and the restfulness of your sleep. So alcohol will artificially get you to sleep, but it won't help you rest.
Gotcha. So it will help you fall asleep, but you won't rest. You won't get into that level of rest that you
need.
Okay.
Exactly.
All right.
And I mean, rest goes together with restoration. So we have to make sure that the brain is getting restored.
Okay.
Right.
Any final thoughts on sleep?
Well, number one, that people need to be respectful of sleep. You know,
Yes.
It is essential. You see, we don't have second thoughts about drinking water or drinking fluids.
True.
We don't have second thoughts about having our meals. We shouldn't have second thoughts about sleeping well.
That's true.
Is that important?
Absolutely.
All right?
I like that.
Yeah.
I like that a lot. All right.
Thank you.
Well, thank you very much. We'll see you guys next time.